Good evening, everyone. So my next video is on other some other drug interactions, that is drug interactions too. And before I start my video, I want to request you, if you like this video and it is helpful and useful to you, kindly subscribe to my YouTube channel. This is Dr. Nitika Pharmacology Discussion. And now I'm going to discuss with you some other drug interactions. First is beta blockers and calcium channel blockers. A cardiac congestive heart failure patient was taking metoprolol. He was prescribed verapamil by another cardiologist without asking what he was already taking. Next day, patient was admitted in intensive care unit with severe bradycardia. What happened to the patient? Which other drugs can lead to similar situation? So a congestive heart failure patient was there and he was given beta blocker, which is metoprolol, and he was prescribed verapamil, which is the non-dihydropyrimidine by the cardiologist. So and the patient landed with severe bradycardia. So what happened to the patient and what other drugs can lead to similar situations? This is enhanced depression of the myocardial function, decreased AV conduction, excessive bradycardia, as metoprolol and verapamil are both cardiac depressants. As you know, this is the metoprolol is also cardiac depressant. It will block the beta 1 receptors. So it will block the cardiac stimulation. And verapamil, it is also the cardiac suppressant. It will decrease the heart rate and decrease the conduction velocity. So nifedipine may be used along with beta blockers when required, as it is not the cardiac depressant. So nifedipine is the vasodilator, and it can be given as the drug to treat the hypertension, and it can be used with the beta blockers when required because it doesn't cause the cardiac depression. So other drugs which can cause this uh, bradycardia and cardiac depression is atenolol, propranolol, and diltiazem. These drugs can also cause the cardiac depression. Next is spironolactone and enalapril. A 45-year-old male hypertensive patient was stable on enalapril for the last 1 year. He was prescribed spironolactone for the congestive heart failure. After 5 days, he complained of palpitations and restlessness. Now he was stable on the enalapril and he was prescribed spironolactone for the congestive heart failure. And he developed the palpitations and restlessness after 5 days. So, what happened to the patient and what other drugs can be used can lead to similar situation? So, using enalapril together with spironolactone may increase the levels of potassium in the blood. That is, it can lead to hyperkalemia, especially if there is dehydration, CHF, or older patients. Enalapril has the side effect of hyperkalemia, and spironolactone is also the potassium-sparing diuretic, which also causes the hyperkalemia. So, other drugs which can cause this hyperkalemia and is aplerenone, tramterone, and amiloride. They can also cause the hyperkalemia along with enalapril, leading to palpitations and restlessness. Arrhythmias can occur. Desloratadine and clarithromycin. A 35-year-old male was prescribed desloratadine and clarithromycin together for sore throat. Next day, he was admitted in cardiac casualty with arrhythmias. So, what happened to the patient? Which of the drugs can cause similar situation? Now, he was prescribed desloratadine and clarithromycin together for sore throat. And desloratadine is the antihistaminic drug, and clarithromycin is the antibiotic. So it was prescribed. So what was the injection? The patient was landed in arrhythmias. So clarithromycin is the enzyme inhibitor, thus inhibits cytochrome P450 enzyme and thus increases the concentration of desloratadine. It increases the concentration of the desloratadine, increased toxicity of the desloratadine, arrhythmogenic effects. There can be increased toxicity of desloratadine can occur because enzyme inhibition will be caused by clarithromycin, which lead to increased concentration of desloratadine. There will be rhythmogenic effects, inhibition of delayed rectified potassium channels, and QT prolongation can occur, leading to toxicity. C point is other drugs means other enzyme inhibitors are ketoconazole or erythromycin. Ketoconazole is antifungal, erythromycin is macrolide. Warfarin and fluconazole. A 30-year-old male patient was stable with warfarin therapy. He was prescribed fluconazole. After 1 week, he was admitted to hospital with intracranial bleeding. Means a 30-year-old male, he was stable with patient was stable with warfarin therapy. He was prescribed fluconazole. Fluconazole was the antifungal. So then he was admitted with intracranial bleeding. What happened to the patient? Which other drugs can lead to the similar situation? So warfarin is an oral anticoagulant drug. Fluconazole is the enzyme inhibitor. It is cytochrome P450 enzyme inhibitor. It increases the level of warfarin in the blood, leading to toxicity. By inhibiting its metabolism, thus intracranial bleeding occurs. Means enhanced effect will occur. So there can be hemorrhage, intracranial hemorrhage can occur. Enhanced effect of warfarin is intracranial bleeding. Other drugs can be, means other enzyme inhibitors are erythromycin, clarithromycin, and ketoconazole. These drugs can also be lead to enzyme inhibition and lead to intracranial bleeding caused by warfarin. Thank you. That's all. I hope you like this video. And if you like this video and if it is useful and helpful to you, kindly subscribe to my YouTube channel. This is Dr. Nitika, Pharmacology Discussion. Thank you. Be happy, be blessed, stay safe, happy learning. All the very best. Thank you.